Welcome to our community. Susie Thomas with you this morning. So happy to welcome Dr. Tracy Baker from Child and Adolescent Behavioral Health. Good morning.
Good morning, Susie.
We're talking about such a serious topic this morning, fetal alcohol syndrome. And is that your specialization with child and adolescent behavioral health?
It's become one of my specializations. I would say that my specialization more broadly is psychological assessment and especially developmental disorders. I work with a lot of kids with autism spectrum disorders, and fetal alcohol spectrum disorders has been something that I've been really developing specialization in probably for about the past 2 years.
Do you notice any connection between the two?
I think that a lot of times they look very similar. So a child might have fetal alcohol spectrum disorder, and the parents noticing signs that sort of look like they may have autism, and people may mistake some of the symptoms of for one or the other. There are differences between the two.
What are the differences?
I think that the first one that probably comes to mind would be with how they interact socially. There's very specific social deficits or problems that kids with autism spectrum disorders must show. And while there are some social problems that kids with fetal alcohol spectrum disorders have, then they're usually of a different nature. So it really takes somebody with a trained eye to look at the differences to be able to sort those out.
When we say fetal alcohol syndrome, we're talking about preborn, or we're talking about the fact that they were affected by alcohol while they were preborn? And if so, how do you diagnose that before birth, or do you?
We actually can't diagnose that before birth. What fetal alcohol spectrum disorders is and how the diagnosis works is that we, while the damage to the brain or the central nervous system happens before birth, what we're looking at is the resulting symptoms that come after birth. So kids can be diagnosed with fetal alcohol spectrum disorders early on. Usually we get kids when they're about 5 and up, and we start to see signs of the damage that the alcohol has caused to their brain at that point.
So up until age 5, they look like they're developing rather normally. You can't tell when they're a baby that they've been affected by alcohol while they were in the womb?
It really depends on a lot of different factors, such as the timing of the alcohol. So if the drinking is taking place during the times when facial features are developing, then you'll start to see some facial features, which could be a physical sign that you can notice pretty early on. So, for example, the facial features would be a smooth philtrum, so that's the area between the nose and the upper lip, if it's very smooth, or low birth weight, so height, weight, baby's length tends to be, an ongoing problem all throughout somebody's lifespan. They tend to be smaller and shorter if they're impacted by the physical features. Going back to the face, then there's also a shorter length between one corner of the eye and the other corner of the eye.
Really?
So there are some physical features, but not all babies have those. Some babies aren't affected physically, but their brain development is affected in a way where they have more problems with things like transitions and learning from consequences and learning from past behavior and events.
That's the part of learning that's affected. Cause and effect?
Actually, it's so widespread. That is a common one, and it's something that's so frustrating for parents.
Sure.
That's one, but actually it's so widespread. Part of having a fetal alcohol spectrum disorder is that it impacts so many different areas of the brain where they may have difficulty with that. They may have difficulty understanding complex concepts. They may have difficulty like taking in and interpreting sensory input from the environment. So maybe they're very undersensitive or oversensitive to things in the environment. And part of what makes it difficult is it looks so different in each child.
How do you know then that that was the cause? Or if a child is having some kind of difficult experience, you take it back and finally ask the question, did you drink while you were pregnant? Is that how it comes about?
Yes, but it's actually a lot more complicated than that. We have started in the past 2 years a fetal alcohol spectrum disorders clinic at CNA, and not many people are trained in this. We're the only clinic. We're the third clinic in the state of Ohio that has this training to look at everything as a whole, to understand the patterns of alcohol use during pregnancy and the timing of alcohol use during pregnancy and how that aligns with the different physical features that the child might be showing. And then also, my role in this clinic is to do neuropsychological testing. So I'm able to determine exactly how their brain has been impacted based on the difficulties that they're having. So it's putting all these pieces of information together to come up with an understanding of how alcohol may have impacted their brain. And there's no 100% certainty that it was the alcohol, but we sort through and we are able to see whether the pattern of deficits they're showing is consistent with a child who's experienced alcohol based on years of research. And if it is, and they happen to have had alcohol during pregnancy, then there's a pretty good chance that that's what the cause has been.
You can connect the dots at that point.
Yes.
We're speaking with Dr. Tracy Baker from Child and Adolescent Behavioral Health and learning about fetal alcohol syndrome. Tracy, it just seems to me that in this day and age, everyone knows if you're pregnant or you might be pregnant, you don't drink alcohol. How has that message not gotten out when we know that to be true, and we've known it to be true for decades and decades and decades?
And Susie, I don't know that it is something that is commonly known, and I think part of the problem is about 50% of women who are in childbearing age, if you survey them, then they would have said that they've drank in the past month. And I think that, unfortunately, a lot of damage can be done before a woman even realizes that she's pregnant. Often you don't realize that you're pregnant until it's been 4 to 6 weeks. And by that time, people may have been drinking already, and that's when the brain is most impacted. So I think that, that's difficult. And I like to say that, too, just to bring down some, shame that some people may feel. Some people wouldn't say that they've drank during pregnancy because there may be some shame in how, and worrying about how people will perceive them and worrying about being judged for it. But the fact is that people don't always realize that they're pregnant, as they drink. I think that there's also some misconceptions out there. Even physicians have told women that it's okay to have wine every once in a while, 1 glass of wine per week. And that is very outdated information. Information reflected by the current research, information relayed by the Attorney General and put out by the CDC. Everybody's in agreement that no amount of alcohol is safe for the developing brain of your baby.
Okay, and let's repeat that again. No amount of alcohol is safe for the developing brain of your baby. How prevalent is it then that you are working with children who are born with this?
Well, the Stark County numbers only have about 2 out of 1,000 children diagnosed with fetal alcohol spectrum disorders. Fetal alcohol syndrome, the full syndrome, and then there's about 8 more who are diagnosed with another alcohol-related neurodevelopmental disorder. I know that's a lot of big words.
Yeah, we'll go back. We're going to peel that all the way back because I want to understand. Yeah, go ahead.
So it sounds like a small number, but then when you look at certain populations, like kids who are in foster care or kids who are adopted, the number is a lot higher. So you probably go to about 10 kids out of every 1,000 who have the full fetal alcohol syndrome. But I would say that that's still probably a dramatic underestimate of how big the problem really is.
Help me understand the difference. Full fetal alcohol syndrome or having something on the spectrum of disorders, very similar to children with autism. But the fetal alcohol spectrum disorders exhibit themselves in what way?
So a full fetal alcohol syndrome, a child would have various physical difficulties or various physical differences. So they would have to have at least 2 physical differences, and it could be with the facial features. I mentioned a couple of those before with the flat philtrum or area between the nose and the lip, the smaller eye length, So they would have facial features and then also growth deficiency. So growth deficiency is being substantially below the weight or height that you should be based on your age, based on your parent's stature, and then also based on nutritional aspects. Sometimes we need to look at whether a child was sick early on or wasn't exposed to the right nutrition, and we take all that into account. So we're looking for growth deficiencies that don't have any other cause. So they would have to have those growth or physical differences, and then also evidence that there has been widespread damage to the brain. And we can tell that by doing a full battery of neuropsychological testing. And, we're able to look at a bunch of different areas like their learning and their language skills and their problem-solving abilities, their ability to learn from information and make inferences. So they would have all of that. Well, somebody with an alcohol neurodevelopmental disorder may just have some aspects, but not the full package of symptoms.
I'm really fascinated by the fact that one of the difficult things as far as their cognitive development is saying cause and effect and learning outcomes and consequences. How difficult is it to parent a child if you can't teach consequences? And when you do this, this happens. Play out in the street is dangerous. Touching that, it's hot. It will burn you. My goodness, do you work with the parents then? And I'm thinking many times you're talking about foster parents or adoptive parents who have taken these children into their homes and are trying to teach them, but you're starting with a different blank slate than you ordinarily would be. How do you instruct parents, and then let's take it even beyond into the classroom, teachers, how to teach children who are at this disadvantage?
And Susie, you have, definitely hit what the main central difficulty is with this population, because adoptive parents often don't know at the time that they're adopting the child that they have this. And it is extremely difficult to families because they have seen multiple therapists by the point that they get to us. Normally they've gone through multiple evaluations. We're trying all of the state-of-the-art behavioral techniques that usually work for other children, and the conclusion that parents and teachers come up with is they just don't want to be good. They're just bad. They don't want to behave. And what ends up happening is that there's just a lot of frustration towards the children, and the children are essentially getting demands that they cannot meet because their brain has been damaged. And that's where that's usually what gets them to the point where they're getting tested for this, because we're just trying to figure out something that's going to work. And unfortunately, there's no way to get them to grasp consequences and to be able to learn from past experience and to be able to be independent enough to trust not to go in the street when cars are coming. So what we end up teaching parents and teachers is that you almost have to serve as their external brain. They need a lot of structure. They need a lot of predictability. They need a lot of consistency. So learning over and over and over. And what's frustrating is sometimes you feel like something has worked because you have that consistency and they seem to be responding. You found a disciplinary technique that works, but then it seems to go away all of a sudden. And that's just the nature of what parents and children are putting up with when they are unfortunate enough to have a fetal alcohol spectrum disorder.
It's so sad. These children did not sign up for this. They're completely victims, and it's tough seeing them struggle. We are speaking with Dr. Tracy Baker from Child and Adolescent Behavioral Health, learning about fetal alcohol syndrome and spectrum disorders, and we'll be back after these words. You're listening to Our Community.